Good morning again. My name is Nevin Cohen, and I'm an associate professor here at the CUNY School of Public Health and the research director for the CUNY Urban Food Policy Institute. And I'm really delighted that you came out this morning to our forum this month. We have monthly forums for those of you who are here for the first time. And can I actually just see a show of hands? How many of you are CUNY students or faculty? Okay, good assortment. How many of you are work in nonprofit organizations that work on food issues? Okay, good. And any folks who work for city agencies or state agencies? Okay, and I guess the rest of you are in different sectors. We really aim for these forums to bring together the wider community of people interested in food policy in New York City, and it's usually a very diverse group. And I'm delighted that you're here today. Today's forum is going to be a little bit different, but before I introduce the speakers and tell you about today's forum, I want to mention that next month we're having a forum on food democracy, a really exciting topic. Yes, thank you, page down. Practicing food democracy, the question of how to really engage the public in thinking about and advocating for food policies in the city, state, and federal government, and how to best organize communities to practice food democracy is a really exciting and important topic, especially as we begin to think about the next national election and next mayoral election in 2021. So hope you'll mark the date in your calendar and plan to come. The Urban Food Policy Institute has a project called the CUNY Food Collaboratory, and the CUNY Food, welcome everybody who just arrived. We know that there's subway problems, as there always are when we have forums, so have a cup of coffee and make yourself comfortable. The Collaboratory is an effort by the Urban Food Policy Institute to really bring together faculty from the 24 different CUNY campuses who work on food research and food issues and who teach about food, including people who are involved in culinary skills programs, people from a wide range of disciplines, from the professional schools to sociologists and anthropologists and geographers across the campus. And so this forum is a first of what we hope to be regular gatherings of faculty who are going to present their current research, and will give us an opportunity to meet different faculty from across the university and to have a chance to talk with faculty members who we might want to collaborate with, work with, take courses from. And so the format for today will be very brief 8-minute presentations from each of our 5 guests, and then we will take clarifying questions only after each presentation. If somebody uses an acronym you don't recognize, you can ask a question. But we want to hold the discussion till the presentations are over, and then we're going to break up into spend an extra half hour with opportunities for you to speak to different presenters in small groups. And so we're not going to have a formal panel afterwards. And we hope that that format is interesting and gives you a chance to really speak to people one-on-one. And let us know if you like it or if you have suggestions for future forums. So without further ado, I want to introduce the first speaker, Mark Edelman, who's a professor at Hunter College and the Graduate Center, and is an anthropologist who works on rural development issues, particularly peasant and farmer movements, mostly but not exclusively in Latin America. And his most recent book, Political Dynamics of Transnational Agrarian Movements, has been translated into Spanish and Japanese, with versions pending in a variety of languages. His work focuses a lot on the issue of food sovereignty, and that's one of the topics that he'll be presenting now. So without further ado, I'd like to invite Mark to come up to the podium. Thank you.
Nevin, and thank you for the invitation to be here today. I will try to summarize a very complicated set of ideas and politics in just a few minutes. Food sovereignty is an idea, a demand, and an aspiration world. It originates in the period in the very late 1980s and early 1990s when global agricultural trade was undergoing a process of very rapid liberalization that pretty much everywhere in the world destroyed the livelihoods of massive numbers of small farmers and peasants. And the demand for food sovereignty, which geographically originates primarily in Central America and in Western Europe, was basically a call to regain some kind of control over the food and agriculture system. And as peasant farmers in Costa Rica and Honduras used to say to me, to appropriate the wealth that we produce. Okay, because the image of many urban people is that peasants are living in poverty and the challenge is to have policies that allow them to appropriate the wealth that they produce. So the movement for food sovereignty is taken up by peasant movement and farmer movement in many parts of the world. There was a very large conference of these movements in Mali in 2007, which identified what they called the 6 pillars of food sovereignty. So food for people rather than for agribusiness and inputs into industrial food. For the right to produce food and the solid livelihoods of food producers. It has, in most iterations, a very local focus and is respectful of nature in contrast to industrial agriculture. So that's what came out of the conference at Nyeleni, Mali in 2007. Oops. Okay. And when I first started to hear about food sovereignty in Costa Rica and Honduras in the 1980s and 90s, there were actually many different terms that people were using that all referred kind of to the same idea. And they were reacting to the destruction of an ancient culture of maize that had existed in the Central American region and in Mexico since before the Europeans got there, before the Africans were brought there, and to this very rich culture of maize cuisine in rural areas, of the tortilla, of the tamal, of atol, and all of these maize-based foods. So there were a lot of terms that were mixed up with each other, and eventually food sovereignty becomes the term of art. I think it's useful to think about 3 different frameworks as being located on a kind of political and policy continuum with some overlap. Food security is an idea that has existed for a very long time. One of the main commonalities is that it refers to just sufficiency of supplies, usually at the national level. So that if a country has sufficient calories for its people, then it's considered food secure, and if it doesn't, it's food insecure. Right to food is a different framework. Again, it's very widely recognized in international law, which essentially is focused on the access that individuals have to adequate and culturally appropriate food, but without saying anything necessarily about how that food is produced. It could be produced by small farmers using agroecological methods, or it could be produced in giant monocultures using industrial agricultural methods that are basically wrecking the environment. And finally, food sovereignty is this idea that has gained increasing acceptance, but is still rather contentious, that speaks to the aspiration to have democratic control over the food system. And originally, like other notions of sovereignty, it was kind of state-focused, but increasingly it is people-focused, and its advocates see less of a role for states than used to be the case. The idea of food sovereignty has been propagated at the international level by the transnational agrarian movement Via Campesina. This is a very large coalition of movements in many different countries, many different world regions. The Guardian a few years ago said that it was arguably the world's largest social movement, and I wouldn't quarrel with that. Since I have almost no time left, I'll just say that there are some people who suggest, and many food sovereignty advocates say this, that food sovereignty is in some kind of a conflict with food security as an idea. I think if you really unpack the genealogies of these concepts, there's more overlap than people often acknowledge. But at the same time, the food security idea, as deployed by United Nations agencies and so on, doesn't contain the notions of autonomy, of the right to produce food, of ecological sustainability and equity that are part of food sovereignty. The final thought that I think I'll leave you with, since my time is up, is when we think of the right to food, I'm assuming that most people in this room are U.S. citizens. It's important to understand that our government does not recognize the right to food as it exists in international law. The United States actively opposes the inclusion of the phrase right to food in any kind of international legal instrument. And I had occasion to witness this over the past 8 years or so when I've been doing research intermittently in Geneva around the efforts to have the UN approve a declaration on the rights of peasants and other people working in rural areas, which was just approved and which the United States adamantly opposed all the way along. So there's a lot of work to do, even for the idea that human beings have a right to food. Thank you very much.
Thank you, Mark. That was a really excellent framing for the next speakers. Our next speaker up is Melissa Fuster, who is an assistant professor in public health nutrition at Brooklyn College, and is interested in the sociocultural factors affecting food selection and consumption, and will be speaking about current research focusing on food environment regulations and interventions, and the nutritional transition in the Hispanic Caribbean region and its New York City diaspora. So without further ado, Melissa, welcome.
Thank you so much, and thank you, Nevin, for having me. And I am working right now, it is the case, on research that relates to the Hispanic Caribbean, but today I'm going to take you to a different region, the Central American work that I did actually back when I was a PhD student. And also I want to thank Mark, because what he presented It's a wonderful background to some of the issues I'm going to talk about today, and how a lot of these aspects around food production, food sovereignty, then translate into consumption. So some of this work, and also the work I'm also currently doing with the Hispanic Caribbean, stems from a realization that a lot of what we know related to Latin American populations in the U.S. has to do mostly with Mexican American populations. And it is the case that Mexican Americans are the largest segment of the Latino population, but we do have a growing population of other Hispanic groups, including in this case, a growing population of Central American communities. I mean, if you think, for example, of the immigrant caravans, that brings back a lot of these movements that are happening in the region because of violence and very important contextual factors. So the research I'm briefly going to be presenting today aims to fill some of these gaps. And it sought to address healthy eating using a social, ecological, and binational framework. The study used secondary data. I combined the data that I collected back in my doctoral dissertation in 2013 doing focus group with Salvadorian communities with data collected by a colleague of mine in George Washington University, collected from a suburban area in Washington, D.C., using a photo voice approach. And again, our goal was to provide a more comprehensive understanding of healthy eating in this population beyond just individual factors, and including a view of the food environments left behind in Central America, again, through these binational perspectives. This table, of course, merits a longer conversation that I have time for. I'm looking at the timekeeper right now. But it is to say that it was interesting to see that there are many, many overlaps when we look at how people talk about healthy eating in these two very different contexts. In both settings, as maybe you can hopefully see here, people contend with issues around time, seeking convenience around healthy, around eating, issues of food preferences, dealing with the kids' food preferences for processed foods and fast foods. And we also found, and this is not surprising, that there was a persistent preference for traditional foods and some difficulties in trying to preserve this traditional diet, both in El Salvador and in the central communities in the Washington, D.C. area. I usually will take you through the whole social ecological framework, but for today, I'm just gonna highlight the community piece. And this is where we see a lot of differences, of course, in physical environment. The D.C. area where the research was conducted is, as you can see, and you can see here, is a fairly suburban area. You can see a lot of strip malls, supermarkets that really contrasted with the environments I saw back in El Salvador. There are supermarkets in El Salvador, especially in the capital, but for the communities I did my work, these supermarkets were about an hour away. So in terms of for people to have access to food and eat, they did rely a lot on home food production. So access to land, water, seeds was very important to people. But also they were starting to rely more on stores. And you can see some of those pictures there of those stores where we would see a lot of processed foods, soups, Maruchan soups like the ramen that for some students, unfortunately, you might be familiar with them. So again, and this contrasted a lot when women in the Washington, D.C. area spoke about this access to food. They did talk about the variety of foods, and here you can see they were able to access healthier foods, salads, new fruits that maybe they didn't encounter back in El Salvador. But still, one important contrast that I want you to see here is that it is important to remember that in both settings, the industrialized food environment is very, very present, and that highly processed foods tend to be consumed in both settings, due to the low cost, convenience, and also if we face a taste. These foods have a special taste that kids and some adults also enjoyed. And in the Salvadorian context, it gets further complicated because the consumption of these processed foods was also tied to notions of prestige. That is, if you were able to afford fast food, which in the Central American case is Pollo Campero, I don't know if any of you is familiar with this chain. I see some happy yeses, yes. If you're able to afford that, that was a sign of prestige, that you were doing better off, compared to people that if you were consuming wild forage food, even locally produced foods, those were seen as foods eaten by animals, some people spoke about that, or very low prestige. In other words, a sign of poverty. So in conclusion, just in time, this binational analysis provided important insights on the social ecological framework shaping food practices in these two settings. And with this, we hope to offer a counter-narrative to prevailing and what we argue were overly simplistic views that Hispanic immigrants encounter these processed fast foods upon arrival to the U.S. As I hope I can show you here, these preferences are already being formed back home, in this case in Central America. And these were, going back to the previous presenter, it talks about how, of course, this can be a longer conversation about how the changes in food production back in the region are affecting not only the consumption in Central America, but the taste for certain foods that people, when they arrive to the U.S., come with that. So, of course, if you see a very cheap combo in a fast food and you can afford it, people are happy to eat it because, again, that's something that back home they maybe couldn't afford. So, again, I'm happy to continue this conversation a little bit later today, and thank you again for your attention.
Thank you, Melissa. And our next speaker is from Lehman College in the Bronx. We've gone from Hunter to Brooklyn to Lehman. Kate Gardner-Burt is an assistant professor at Lehman and is a registered dietitian and culinary nutritionist who teaches about community and public health nutrition and cultural food and sustainability. And today she'll be speaking about urban food production, which relates to food sovereignty in the global north, and some of the language around food sovereignty has been appropriated by the urban agriculture movement in the global north. Dr. Burt also published a cookbook in 2015. She's a foodie and farmer's market fanatic. So welcome her. Thanks.
So, hi. Thanks for having me today. It's nice to see so many people in the audience. I know the trains were delayed, so thanks for making the trek up here, and thanks for having me today. My work diverges a little bit from the folks that we just heard from, but I think is definitely related, as Nevin alluded to. Today I'm going to talk a little bit about my work around school gardening specifically, which is something that I've done for the last several years now, and this is one piece of that. So why school gardens? There are millions of dollars invested in school gardens nationwide, hundreds of thousands in New York City alone. And there's not really a lot of research that tells us how to integrate and sustain them so that multiple cohorts of students can benefit from them years after years. And there's not a lot about how to overcome challenges and barriers that school gardeners experience. So as you can imagine, there are not a lot of resources targeted to address these needs. As such, it's unlikely that students are going to receive these benefits that are well documented and well researched. So there are academic benefits, that is, students improve their academic achievement in many different subjects. As a result of gardening, there are dietary benefits. Students increase their preference for, willingness to try, and in some cases even their intake of fruits and vegetables. There are also physical benefits. Gardens get students moving, and we know that students typically don't move enough these days. And then there's also psychosocial benefits. There are intrapersonal and interpersonal benefits to school gardening, such as increased cooperation, improved self-esteem as a result of gardening. And so again, in order for students to receive these benefits, we need to make sure that school gardening programs and the dollars put into them are put to effective use and are sustained over a period of time. And we know very little about the actual barriers. We know that, like many school programs, gardeners struggle with time, with staff, with funding, with space, but that's, until I started looking into this, that was really about all we knew. So there's a good chance that we're not using the money effectively, and that we could develop more successful strategies if we really understood the barriers that gardeners experience. So I did a nationwide survey just to kind of get a sense of the lay the groundwork for this study. I did this through the National Farm to School Network. School gardening is generally considered one aspect of farm to school programming, and there's not really a good communication channel to reach school gardeners across the nation, which is possibly why this work just generally isn't done. So with this survey, there were 99 respondents across 15 states. And these were your average school gardeners. They were in operation for generally about 1 to 5 years, and they had an annual operating budget of $2,000 or less. So these weren't highly resourced gardens that had lots of money being pumped in. This was your average struggling school. The survey also got disseminated through New York City's Grow to Learn, who some of you may know, and Washington, D.C.'s Real School Gardens organization. So we did have greater representation among survey respondents from those areas. But again, across 15 states that were spread across the U.S. And we really found a few different things here. So gardeners were asked to rank the main challenges from greatest to least. They noted that the greatest challenge was time, second to that was staffing, then funding, and the fourth and fifth respectively were curriculum and the garden space itself. So people weren't really struggling with the garden space so much. Within time, not only time for classes to use the garden, but time to train faculty and staff was a significant problem for many of the respondents. There were also an inadequate number of volunteers and general teacher or faculty disinterest in the garden itself. And then gardeners also lacked funding, generally, and they lacked an awareness of funding sources, which are obviously problems to continue and integrate and sustain a garden. We also looked into how gardeners would allocate resources, or specifically I'm going to talk about how they would allocate additional funds. And this is where I think some of the interesting results, I can highlight some of the interesting results. The primary place that they said they would allocate these funds is in the infrastructure, which is really confusing because the space is the thing that they're struggling with least. So I'm going to come back to this in a minute, but I think it's really interesting that that's where they said they would put their funding. Second to that, about 28% of gardeners said that they would like to hire outside educators to conduct the garden education. Also interesting because they also reported that hiring outside educators is actually a problem because they're not experienced in classroom management like teachers are, and they don't have a sense of the overall broader curriculum. So while they can make many important connections for students to the curriculum in general, they can't tie it into what the students are doing on a day-to-day basis and across their courses. And then only about 20% of gardeners reported that they would put funds into program expansion, which included professional development, curriculum development. This is also really interesting because, as we just saw on the previous slide, time to train faculty and staff, and then disinterest, teacher disinterest, are two of the biggest barriers that they reported experiencing. So this is really important because teachers in most, or I think all states, are required to maintain their credentials through professional development, right? So we can capitalize on this opportunity for teachers needing to maintain their credentials, and we can use this opportunity to create professional development that both motivates and excites teachers to start using the gardens more, and at the same time gives them a little bit more confidence and teaches them the horticultural skills that they need to be able to sustain the gardens and participate in them longer term. But again, since only 20% of school gardeners surveyed reported that they would actually put money in this area, I think this reveals a really important disconnect between what gardeners report their barriers and their challenges are versus how they would allocate additional resources and funds. So while in the study we hoped to identify the barriers that school gardeners were experiencing, I think what's more interesting is that we really found out that not only do they experience some barriers, they're really not sure how to overcome them. And that's an important area that we can talk about in the future and move forward in both research and policy-wise. Thank you.
Thank you very much. And as you can see, the range of research at CUNY ranges in scale, in methodology, in discipline. Our next speaker, Karen Flores, is a faculty member here at the School of Public Health. She studied medical anthropology and then went on to focus on the sociocultural determinants of health at the Mailman School, and went on to work at RAND doing research on various types of food access interventions, and will speak to us today about her current work looking at the interplay between sociocultural and neighborhood level factors related to obesity, and focusing specifically on institutions like churches and their role in providing food access to communities in the U.S. So Karen, without further ado, welcome.
Thank you so much, Nevin. Good morning, everyone. Could we do that again? Good morning, everyone. Great. So actually, I'm going to be presenting on work that actually focuses much more on the sociocultural factors that my research agenda has been focusing in. So basically, I'll be looking at I'll be talking about a paper that looks at the dual burden of generational status and food insecurity. So Mark made the point that there's sort of this term, right? Food. What do we actually mean by food insecurity? And for my particular paper, I really am using the USDA, the United States Department of Agriculture's definition of food insecurity, which basically kind of defines the experience really at the household level, not really an individual experience. And it sort of focuses, sort of defines that experience as households that basically have difficulty consistently allocating food for all members of the household. So just wanted to start out with sort of some definitions there. And what's interesting about this work about on food insecurity and obesity in public health is that there's really been a paradoxical relationship, if you will, between food insecurity and obesity. Really, the consistent findings have mostly been on women who have longer periods of participation in federally funded programs like SNAP. But we're sort of puzzled, right, about this idea that people who are food insecure might be more obese. And really, there's quite a lot of inconsistency if you look at other samples. So I'm particularly interested in Latino youth. And why am I interested in Latino youth? Because as many of you know, may know already, there's Latino youth experience quite a bit of health disparities compared to other groups, and obesity included. And sort of food insecurity and what I call immigration generation status might have a really interesting interplay in sort of how we appreciate risk among Latino youth. Specifically, we know that that Latino households just experience food insecurity at much greater rates than national averages. We also know that Latino immigrant households tend to experience food insecurity more. There's this relationship between immigration and generation status and obesity in sort of the larger Latino research. And it gets quite complex because for adults, for example, we really do see quite a bit of a consistent relationship between increased either length of stay or increased generation status and greater obesity risk. But not that consistent, but there have been some inconsistencies among Latino youth, and I sort of hypothesize that it's about the way we're sort of missing a lot of the heterogeneity that is embedded in the ways in which we categorize this humongous ethnic group, right? I was just talking to a couple of you about just about that issue, right? So there's sort of this tension, if you will, between food insecurity, immigration, and generation status. But I think that with the right methodological approach, in which my colleagues and I attempted to do in this paper, we basically wanted to look at the joint effects of this relationship. And we did that by basically pooling 7 waves of the National Health Interview Survey, so to get at a pretty large sample of Latino kids, representative sample of Latino children in this country. And let me just walk you through the generation status. So you typically see first and second generation and third generation, with first generation being children that are foreign born. In my particular paper, I included both children that were foreign born that had either only one foreign born parent in the household as well as 2 foreign born parents in the household. Again, to get at sort of that heterogeneity that I discussed. Then the second generation, we have the child that is U.S. born, which again, it aligns well with sort of how generational status is typically depicted. But then I include both those children that only have 1 foreign born parent as well as 2 foreign born parents. Again, this sort of more nuanced distinction is typically not is restricted in most analyses, and that's sort of what I'm leveraging here. And then the category that's really quite unique is that for the first time we've been able to actually parse out this 2.5 generation, meaning those children who are U.S. born but that have both a foreign born parent and a U.S. born parent, right? So because usually they just get lumped together with the second generation. And to end this categorization, the third generation is sort of your classic child U.S. born with either 1 or 2 U.S. born parents. And I just make notes that, of course, we can talk about during the breakout groups about like the methodological details. But then, remember, I'm sort of interested in the joint association between the generational status and the food insecurity, right? So we took this sort of more nuanced categorization of generation status and looked at it across food insecurity, both by food secure and food insecure across these generations. And just so that on the next slide that you interpret the prevalence ratios, we're basically using the food secure first generation as a reference category because we think we hypothesize that they would be the least at risk, right? So I know these are lots of numbers, and just to point you, these are the joint effects of generational status and food security. These are actually 3 separate models. One is just that I wanted to show you the unadjusted model, the model adjusted for child level factors, and the model and the second model adjusted for both family and household factors. And I'm getting the 2 minutes warning. Thank you so much. But basically, I do, and of course, we can talk about all these prevalence ratios, right? But what I want to sort of what we found consistently that was significantly the groups that were significantly at greater risk for obesity were these 2.5 food secure generation youth. as well as the third generation food insecure youth. And sort of where I think we could move the field forward is sort of looking at typologies within these groups, right? Because the 2.5 food insecure children might actually be exposed to what we might call dissonant acculturation patterns, right? Because you have the foreign-born parent and the U.S.-born parent, and that it might actually not be as seamless as we sort of think it might work, and hence the reason why we might be seeing this increased risk. And of course, I have lots of ideas about how why third generation food insecure are also at higher risk. And I think here too, it's the importance of looking at vulnerabilities of youth as they acculturate into this country, and sort of really questioning this linear model in public health where we think people are acculturating at the same rate and in sort of these seamless ways. I know there's lots of limitations to my research that I would gladly talk about as a group, but nonetheless, I think this sort of more nuanced categorization of generation status is at least a first step to get us thinking. Thank you so much.
Thank you, Karen. There's fascinating work to try to address the complexities of the questions that we're all trying to grapple with, because they're not linear, they're not simplistic. Our final speaker this morning is Charmaine Alyung, who's a professor at Bronx Community College. She is a registered nurse and registered dietitian nutritionist, and has a master's degree in nutrition from Teachers College at Columbia and a master's in nursing from Lehman College. And she's focused her work a lot on a question that's a big policy issue today, which is how to ensure that college students are not food insecure and are healthy, which is a big issue for our institute. We have projects underway that are really focusing on food security at CUNY in particular. But without further ado, welcome Charmaine Alyung.
So good morning. It's still morning. Okay. All right. So I'd like to tell you a bit of my background. As a registered nurse, I worked in the Bronx for over 10 years as a visiting nurse. I worked in intensive care, I worked in clinical practice, and as a nutritionist as well, I worked with young adults. And I came to Bronx Community College because I wanted to make a difference. As a nurse, I saw people with diabetes, people were blind. I had to do wound care, medications, all that type of thing. And I said, I have to make a difference at a level of prevention. So I ended up, to my great satisfaction, at Bronx Community College. Now, I teach nutrition there, and I thought I was doing a great job because I had students talk about nutrition, do food records before, and then food records after, while I taught nutrition, and I encouraged food and vegetable intake. And I said, well, this is it. I love it. Until I got to realize, though, that, look, in addition to teaching healthy eating, I realized that we had a great level of food insecurity at the college. Now, what they have found that 1 in 5 students at CUNY were food insecure, but that was done several years ago. Last year, some researchers at the college found that maybe 90% of our students at Bronx Community College were food insecure. So it's a high-risk community. It's a high risk for medical reasons, obesity, hypertension, diabetes, all the things that I saw as a nurse. And so I had an opportunity, I felt, to make a difference. But was I really making a difference just by talking about it and having students do food records and having students go home and increase their food intake. Well, I thought I was. But there were some more issues ahead. And then I got a knock on my door one day. And it was some students who said, Professor, we want to do more. We have a $2,000 grant, and we want to create a food garden. Oh, food garden. And we want to dedicate it to the Child Development Center that we have at the college to help teach young people how to garden. And I said, oh, good job. How did you find me? And they said, word of mouth, that you are a master gardener. And I was. I'm a master gardener from Cornell Cooperative Extension. And would you help us? Would you be our food advisor? So you see, the students came to me. I didn't think of this brilliant idea of a food garden. They came to me. And this is Alicia. I worked with them. We started a garden with the cooperation. You have to get cooperation for the administrators. And actually, they were willing and able when they saw that the students were excited about it. But, you know, what do good students do? They graduate. And they left food advisor with the garden to carry on. Anyway, I collaborated with a biology professor, and we carried on the garden, and it's been going on for 8 years. And the thing is, I decided to make it a food and garden club. And then we meet once a week for 2 hours, and then we cook. And here is where we address food insecurity, because it's a hands-on learning experience. The thing is, you can get students to a certain point where they'll go home and make changes based on what you say. But listen, our students are high-risk students for all these diseases, but they are going to be future health educators. They're going to be future nurses. They're going to be future nutritionists, and they are living in that community of high risk, and they're going back to that community as role models. So it's important to train the students to be role models and to change and adapt healthier eating habits for themselves, their family, and their community. So having a garden helps the students identify with agriculture, where food comes from. In an urban environment, some students are not familiar with how the food is grown. And of course, you know, it supports mental and physical health. And it's a small space. It's not some huge, beautiful garden like Kingsborough Community College and all that. But it was sufficient and motivating for our students. We taught small space gardening, and we were able to get fruits and vegetables from the garden and go to the cook shop and use some of the vegetables. So here's our delightful food and garden club. Students from all different backgrounds and ethnicities, and they develop skills. You know, some of the students that we have now, they don't cook. They don't know how to cook. But they can learn food safety and develop food preparation skills, slice, dice, julienne, such. Then we practice, we sit and have small group meals, and we socialize, and they get to interact with a professor who can help steer them in certain directions, but they interact with their friends who say, oh, take that, professor, take that one, don't do this and that, and they really enjoy that interaction socially and culturally. We have a couple of students here. One is Mark, president of the Food and Garden Club, and we have Aisha, who's past president and has graduated from the college, and they know what it is like. You can talk to them later about the Food and Garden Club. And here we have a student, and she's from Africa, and she's demonstrating maybe how to make jollof rice or different things. And I have different brochures that they have developed to connect with our food pantry. Just a couple of years ago, we have a food pantry, and I had students develop brochures with recipes using foods from the food pantry. So we cook, we use the peanut butter, we use the brown rice, and they use it with their cultural identity. So we make African peanut soup, we make Dominican black beans, all using many of the food pantry items. Now, as one of the professors said, it is challenging having a garden because the students are busy. The garden comes to fruition when? July and August. And you know, at a college, students are mainly not really there. Their mind is gone mid-May, focusing on exams. And the garden is, getting ready to bloom July and August. So it is a challenge maintaining that garden with minimal help and with volunteers or students that need attention in terms of managing the garden. So it is worth it, though, for our students. And I think I've learned, too, that other gardens have those same issues that we have to realize and incorporate, though, at the college level. In order to reduce food insecurity, the students have to know the value of eating fruits and vegetables. And here I have some of my wonderful students. They've all graduated. And this is the middle one is Charmaine. She's given me permission to talk about her. She was the Food and Garden Club president 3 years. Inner city, born and bred. She didn't realize that green thing. What is that green thing there? What do you think that is here? What does it look like? It's a green tomato. She thought, oh my gosh, tomatoes are not green. I buy from the supermarket. I've never seen a green tomato. Is it an apple? I said, no, that's a tomato. She never saw it. She was, oh! And then I gave her romaine lettuce from the garden. She texts me, how do I wash it? Because she bought packaged vegetables. I did not know. But by the end of the 3 years that she was with us, she now texts and does beautiful, she goes on the internet and gets beautiful recipes, and she's showing me how to make chicken and shrimp and such. So she's having a wonderful time, but she was transformed with the garden. And she graduated from Lehman. She's probably in the food and garden, in your Lehman garden. She was probably there. And there they are, socializing and eating. Is my time up? Just about. Okay, so in conclusion, my research paper was a complementary teaching activity for food security and healthy eating behavior change in a college community. The Food and Garden Club addresses this issue of food insecurity. But it's 15 to 20 people per semester. It is not the whole college. Okay.
Thank you very much. Thank you in the traditional way, all the speakers. Thank you very much for presenting. So this part of the morning's program is for us to informally gather and talk to each other. The speakers are going to be here for another 30 minutes, and there's hopefully some more coffee and tea in the back. So please make yourself comfortable and have us continue the conversation. Thank you very much for coming. The papers are, the references for the papers are in the announcement for this morning's forum and in the printouts that are on the table on the side. So you can get all the papers that people refer to read on your own. Thank you very much.